We got all kinds of stuff for you. So the
Perfect.
lump is nothing to be too concerned about.
Okay.
It's a
Perfect.
lipoma, so it's a basically like a little fatty ball right under the skin, and so that's something that we rarely have to remove surgically. It's a benign, local thing. It should just be right there.
Okay.
And it's soft and non-painful, so it's not bothering him.
Okay.
It might grow over time, and so if it gets really big, then we would want to remove it. But for now, just observe, kind of monitor it. So, but yeah, nothing to be worried about. The eyes, I'm going to show you how to do the eye drops.
Okay.
And so this is it's actually an antibiotic steroid drop, but we're mainly using it for the steroid.
Okay.
And so that's going to help kind of get the inflammation under control, and that's why his eyes are so watery. But it's an allergy most likely.
Okay.
And that's really common. And the sneezing should improve too.
Perfect.
Sometimes we'll use like an oral steroid, but that's a little overkill for this situation. We'll just kind of do something topical and see how he does with that. And so,
All right, guys. So we are giving him some antibiotic eye drops for the wateriness that everybody keeps asking about.
there we go.
He's a good boy.
Yeah, he's easy. He's a good patient.
He's a good boy.
There we go.
He deserves some treat.
And then, so that's the sneezing and eye inflammation.
Okay.
So he's also got the history, and then what you're observing is consistent with bladder pain. With male cats, most often that is it's a condition called feline idiopathic cystitis. Some people call it fluted, which stands for feline lower urinary tract disease. But there's not an infection there, or very rarely there is, especially when these cats have these episodes that flare up, go away, flare up, go away. And that's kind of the history that he's had. Pain medication makes him a lot more comfortable, but the way you manage it over the long term is with prescription urinary food, and that's what this is. It's Hills is the company, CD, and it's their crystal diet. So some cats have crystals in their urine, so that's where the name comes from. But that's going to help manage this. I would keep them on this lifelong. If you do wet food, you can do a non-prescription wet food.
Okay.
But for the dry food, I would stay with a prescription food like this. And so just go ahead and switch them over from the meow mix. And then the last thing is, this is to just kind of get him through the next 5 days. It's something called buprenorphine, but it's a really good pain reliever. He may get a little sedate on it, but you just have to squirt it into his mouth. I can do the first dose just to kind of get that on board.
And then what is that for again?
For pain. Because the licking that you're observing and going to the litter box more often, it's going to help relieve that pain. And then in the meantime, usually these episodes last for 3 to 5 days, and so we're going to put him on this pain medication for 5 days, just to kind of get him through that.
Okay.
And in the meantime, you'll get him switched over to the food.
Gotcha.
And so, what do you say, buddy? So this, you just have to kind of hold on to him again, but just kind of get it inside his mouth. Good.
Yeah.
Oh, sorry. But only twice a day.
Okay.
You okay with that? I'm sorry.
He is a soldier.
Yeah.
Just like his daddy.
Yeah. But that's it. I think we got all the things covered.
So nothing, no harmful. He's getting ready to die or anything like so.
I don't think so. No. If he were to, his appetite were to change, or if he